Coming up on Mayo Clinic Q&A.
When you look at 9 months from when we first identified this pathogen to having a vaccine, that is as close to a human miracle, if I could use that term, as one could expect.
But the promise of those vaccines is not enough for a quick return to life as it used to be.
We and other countries have seen the fallacy of doing that. I mean, on the one hand, there's kind of the human pressure to get back to normal, but at what cost? There's a way to do this, as I often characterize it. Opening up and getting back toward normal is not a light switch.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. We're recording this podcast on March the 8th, 2021. 1 year ago, on March the 11th, 2020, we brought you our first COVID-19 podcast. At that time, we knew very little about this virus, and what a lot we've learned in a year. Thankfully, we've had an expert, Dr. Greg Poland, to come along with us and teach us so much. Now, Dr. Poland has been on our podcast more than 50 times, and he's here again today to celebrate our 1 year anniversary and to tell us more about COVID. Dr. Poland is an infectious disease, virology, and vaccine expert from the Mayo Clinic. Welcome back, Greg.
Thank you. Boy, over 50 times. What a great
Isn't that
team.
something?
What a great team.
It is a great team, and that's just a little bit of the times that you've been interviewed.
Yes.
Greg, I'm coming from home today because I'm off, but I did not want to miss our 1 year anniversary of our podcast, working on COVID-19 as a family here. So I'm so glad to be here with you today.
You know, I do the same thing. I try to schedule everything around this because, you know, the cards and letters we were talking about just before we started here are so encouraging. People constantly telling us how valuable it is, how hard it is to get unbiased information. So I feel like, you know, we're doing something really valuable and worthwhile.
It has been amazing, Greg, and I've been so gratified even with my coworkers and colleagues at Mayo Clinic when I walked down the hall to share with me that they are using our source of information as a true source and for us to bring them the truth and the up-to-date information every week.
It's wonderful.
Well, Greg, let's take a look back. Tell me what has surprised you the very most about all that has gone on in this past year.
You know, it's I guess probably like two sides of a coin. On the one hand, I've been disappointed at making something that is a medical and scientific issue into a political or economic or religious issue. Yes, they have elements of that, but fundamentally, to reject good science-based recommendations because of some misinformation is sad. When you look at that, when I look back over the last year, now 1 out of every 11 Americans has been infected, and as of this morning, 1 out of every 609 Americans has died of a disease we know how to prevent with a simple mask. So that has been discouraging at times. But the bright side is that I think Americans are beginning to understand that. They are masking. I see much, much better masking behavior. When you look at 9 months from when we first identified this pathogen to having a vaccine, I mean, that is as close to a human miracle, if I could use that term, as one could expect. And as of this morning, 1 out of 5 Americans has gotten at least 1 dose of vaccine, and almost 1% of Americans, 31 million people, have been fully immunized. And contrary to polls that we saw early on, the demand is not ceasing. I mean, over the weekend, almost 2.5 million doses of vaccine were given on Saturday and Sunday. And as you know, people are lined up. So I think we've got a real chance with this if people will stick to that. Now, you know, one of the other things that's frustrating is As soon as we make some progress, everybody wants to open up and relax restrictions. And we and other countries have seen the fallacy of doing that. I mean, on the one hand, there's kind of the human pressure to get back to normal, but at what cost? There's a way to do this, as I often characterize it. Opening up and getting back toward normal is not a light switch. It's a rheostat based on observation and measurement. And when you start relaxing mandates, you know you're going to increase those rates. A study just came out from the CDC showing that in counties that relaxed masking restrictions and allowed in-person dining, cases, hospitalization, and death rates just started increasing. So you got to do it in the right way.
Well, that's a lot. How exciting about the vaccination rates. One of the things that surprised me the very most about this year is how quickly life can change. I think I didn't see this coming like many Americans. I was absolutely, completely blindsided when I came home from vacation last year and was told that we were closing down the Mayo Clinic, that life as we knew it was essentially closing down and we were all staying home. And I was really actually personally rather shocked by how quickly that can happen. And what an amazing time to be able to reassess what's important to you and, where we're all going. It's really been impactful, I think, on a lot of people in a lot of ways.
Yeah, well said. It really has changed our notions of stability. For me, all my life, you train for these sorts of things, and particularly in vaccinology with how you mitigate those efforts. And so it is surprising to me to all of us go through that common experience and yet have people who, well, the problem is they don't look at the data. I was going to say, look at the data and decide, no, I don't want a vaccine. That just amazes me. It floors me.
It does. It really is amazing when you think about the fact that the carrot is dangling out there, the hope that we're going to get back to normal, whatever our new normal is. Wow. I guess that remains to be seen, but that's part of this ever-changing landscape.
Yes, indeed.
Greg, you and I have talked many times about the changes in the scientific community, the incredible advances that have been made in scientific discovery during the time of COVID, and the publications. We're, as scientists, we know how long it often takes to work on trials and get things published, and so much has happened in the past year. How has COVID-19 changed the scientific community, and do you think it's changed for good?
I think there are elements that will be changed. I'm a medical journal editor myself, and the number of articles we've received is just a torrent, and it's increased our workloads dramatically. But for a good reason. We're getting that information out, and then it gets digested by the media, and in turn given to the public. I do think that's one of the things that will change. Is we need to find better ways to communicate science and public health messaging to the public. I think mRNA vaccines have just had stunning efficacy and safety. I think we're going to start seeing those used in any disease where antibody against a protein is helpful. For example, in oncology, in allergy, and other infectious diseases. And I think the other thing I've really been impressed with is international collaboration. And this is all the way along the vaccine development line, from regulatory agencies to universities and individual scientists, really putting together these massive phase 3 trials and international studies that have benefited us greatly. So I think that those will be changes to the positive. Unfortunately, George Bernard Shaw said, and I think with good warrant, the one thing we learn from history is that men never learn anything from history. Now, my daughter did point out, he said men. but
I wasn't going to say anything.
My less optimistic part tells me that once we're past this, we'll lapse back into a certain amount of denial. We have never, as a global medical concern, we've never given prevention the due that it should have and the funding that it should have. We like the, exotic scientific things, and yet these are the things, as you pointed out, that fundamentally change human life.
Greg, you mentioned a little bit earlier how many vaccinations were given out this last weekend. Can you bring us up to speed on the numbers overall on vaccinations? Where are we, and how close are we getting to that herd immunity, a point that we need to reach?
Yeah. Herd immunity is a concept that we do talk about. It's kind of a theoretical construct. It's very hard to see how we're going to reach herd immunity in the near future. And the reason for that is, of course, there's a fair number of the population we can't vaccinate yet, right? Younger kids, for example. And then there's a proportion of the population that refuses vaccines. Together, those add up to more than 20% of the population. And at least one study in Brazil showed that you need north of 80% immunity in order to reach this idea of herd immunity. So, as I mentioned, about 1 out of 5 Americans has gotten at least one dose of vaccine. And I think the pace of vaccination is dramatically accelerated. We're headed toward 2.5, 3 million doses delivered a day. My personal opinion is that we need to get one dose into people as quickly as possible. The data are clear on the benefit of that. We need to do what they're doing in New York City. They've got vaccination centers that run 24 hours a day. And if the supply will bear that, I think we should be doing that. I think the other thing that kind of adds some uncertainty to all this is the effect of viral variants, because the vaccines are less effective against preventing transmission of them, even though they're very effective in preventing death or severe disease.
I was going to ask you next about variants, so I'm glad that you brought that up and what we know now about the various vaccines and their effectiveness.
Yeah, so they do differ by vaccine in general, and I'm a bit simplifying here, but for the major variants that we know about, they seem to increase transmission by about 50% and increase their disease-causing ability and lethality by about 30 to 50%. So these are bad viruses. These mutant changes are not good for humans. Now, fortunately, and we have the most data with the mRNA vaccines, and to some degree with the Johnson & Johnson vaccine, the efficacy against death has been 100%. The efficacy against severe disease, 100%. Of hospitalization, 85%. Even though you read numbers, for example, with J&J in the South African arm of the study, of efficacy being about 66%. You have to remember that was against mild and moderate disease. The more severe outcomes, which we really care about with human health, it performed excellently. So still a lot to learn. Our concern is that these variants, if we don't get as many people immunized as quickly as possible, that they'll continue to arise and potentially become more lethal.
But your expert advice, Greg, as you said before, would still remain to take whatever vaccine you are offered.
Absolutely.
Is that true?
Absolutely. Whatever vaccine you have available to you, get that vaccine, get it now, continue to wear your mask until we have large scale immunization. And then that rheostat I've talked about, then we can begin step by step by step in a careful, measured way that doesn't hurt people, begin to reopen and begin to enjoy the lives we knew.
Greg, I read something interesting on the news and I wanted to ask you about it. I had read that obesity affects how effective the vaccine might be for individuals. And I'm wondering why, how, and does it matter which vaccine?
Yeah, this seems to be a common factor for all vaccines, not just COVID vaccines. In fact, an international report was just released, and I thought this was very interesting. 90% of the COVID deaths that have occurred in the world are occurring in countries with high levels of obesity. And you look at those mortality rates, they're 10 times higher in countries where at least 50% of the adults are overweight. Now, there are other studies, and I looked up a few of them. In Italy, obese healthcare workers only developed about 50% of the antibody response that normal weight people developed. And this is even in the US, when they've looked at data like this, the risk of hospitalization among people who are obese was 113% higher, and the risk of dying about 50% higher. Now, why should this be? Well, it's true basically with all respiratory diseases. We've known that for some time. It's true of influenza. Part of it has to do with the fact that they tend to accumulate other concomitant diseases, heart disease, type 2 diabetes, for example. So that adds to the risk. The other thing is that chronic overnutrition is actually a state of mild to moderate immunosuppression. It's immunocompromising. And the reason for that is it leads to a state of chronic inflammation, which directs the immune system in an adverse way. So, what do we do about that? Well, we don't really have a vaccine solution to that per se. And, truly, and I count myself in there, even though I'm able to get outside and exercise, I've gained a few pounds during this COVID year. And probably all of us are going to have to struggle a little bit with being careful about our nutrition and getting exercise.
I like to call it the COVID-15, Greg.
Yeah. Yeah.
There used to be you went to college and you gained
That's
50
right.
pounds the first semester. Now it's COVID.
Or
Always
the
good advice.
COVID-19.
Always good advice to get out there and exercise when you can safely. Speaking
Absolutely.
of getting out there, Greg, you brought up a little bit earlier about people wanting to open things up too early, and some states have moved toward. What comes to my mind immediately is Texas, where I had heard that the masking, that's now very optional, I think, is my understanding. But when people are looking forward to summer, are we going to have a summer where we still mask? Are we going to have a summer where we can get out and do the things that we weren't able to do last summer? Tell us what you see ahead of us.
Yeah, I think something that bears considering is that every step ahead of us is in large part determined by the steps we've just taken. So if we continue down a pathway where people mask, there are restrictions on gatherings, we get people immunized, and we do this step by step, I think we're going to enjoy a nice summer. If, on the other hand, we say, just because we're sick of it, well, let's throw the masks, burn them, reopen dining and sports and everything else, that will determine for us a surge in cases. That will almost certainly occur. And the reason for that is not mysterious. When you still have circulation at a reasonably high level of these variant viruses, they will transmit, in fact, transmit more easily than the strain we faced last March when we were talking about this. So it's really unfortunate that it's sort of human behavior determining this rather than the science. There are ways to do this safely, and there are ways to do it in such that it is not safe and will prolong this pandemic. I think the big news, though, is that by this summertime, I think we're going to have every adult that wants to get a vaccine vaccinated, and that will go a tremendous way in toward dampening this down. Will we have another fall surge? Depends on our behavior now.
So getting back to what you always say, Greg, hands, face, space, and vaccinate.
Vaccinate.
Right?
Absolutely. It's simple.
Greg, we've enjoyed some good time chatting while we're doing podcasts, but also developing a friendship over this past year. And so, I kind of like silver linings. And so I thought maybe you and I could share a couple of silver linings from COVID. And so I'll tell you what mine are. My silver linings of COVID-19, which has so changed our lives, are that it's been a great time to sort of reassess. My world has been made smaller. I haven't been traveling overseas like I typically have, or even to various parts of the United States for medical meetings, to present lectures, et cetera, et cetera. And that's been actually a blessing in disguise. It's been kind of nice to be a little closer to home, to have time to do some more things. My cabinets have never been so organized. And so there've been some good things about it. I also really enjoy Zoom personally. I like this being able to see people while I'm meeting with them from far away. And so I've enjoyed some aspects of COVID-19, and I'm wondering if you have some that you could share.
Yeah, I think for me, I feel similarly. I've been able, even within these confines, to be very productive and I hope helpful. So that's been one thing. The second thing, and maybe it sounds a little corny, but I've been able to spend a lot more time with my wife than I normally would have been, just because of the nature of what I do. And that's been a real blessing. And I think the other thing, as you said, as my world got smaller, my worldview got larger. We're all in this together, all through the globe. And for me, one of the things that began to take predominance is the spiritual side of life, believing in something bigger than myself. As I say to people, plagues and pandemics have purposes, and it would be good for us to attend to some of those purposes and to think beyond just sort of the shallow level of life that we rush through. So I'm actually thankful for those aspects of it.
I agree with you, Greg. I think it's really important for us to be available and ready to learn whatever it is that we need to be taught in a moment. Maybe that will prevent us from repeating it.
I hope so.
Any last thoughts for our listeners today, Greg?
Just what I always want to do is encourage people. One of the things, and we've dealt with it here, is the next pandemic really is one of mental health. And we need to support each other, encourage each other, help by giving good information, not misinformation to one another. And I think Helena, you and me and Jen, who the world never gets to see, who's behind all this, Jen O'Hara, our producer, we've done work that makes me feel good when I lay down at night. We've done good work together. And we can, each of us, everybody who hears this, recapitulate that with our neighbor and family by sharing this information and helping people to stay healthy. We're going to make it through this. We are. Not all of us, because not all of us have taken the precautions. But if we do, we're going to make it through this, and we're going to enjoy our lives again, probably in a more enhanced way than we ever thought possible. So that gives me a lot of solace.
I'm glad that you brought that up, Greg, because I think that while there are silver linings, there are a lot of people struggling. And so our hearts go out to them. No. But I'm certainly glad to be here with you today, sharing information, and we plan to continue to do that.
Happy 1 year.
That's right. Happy 1 year anniversary of COVID-19 podcasts, and more to come.
Yes, indeed.
Thanks to Dr. Greg Poland for being with us today. You all know him well by now. I hope that you learned something today. I know that I did. We wish all of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.